Hello dear students, welcome to Physiology case series of Physiology problem based learning. Today's topic is action potential. So here it's a case, a 7-year-old boy was playing cricket. During his play, parents noticed that he was not able to move his arms and legs and brought him to a doctor. Alright, on the way to the doctor, boy was so weak that he was not able to stand. During history taking, they told that all these complaints were developed after eating banana. Parents also told that previously he had frequent muscle spasm and was not able to grip a bat after eating banana. After detailed physical examination, boy was diagnosed with hyperkalemic periodic paralysis. Doctor advised them to give carbohydrate-rich food during the attack, low potassium food in his diet, and not to perform excessive exercise or prolonged fasting. So that's a typical case of hyperkalemic periodic paralysis. Question number 1. How sodium and potassium ions affect cell membrane potential? Question number 2. What is the effect of eating banana, which is high in potassium, on cell membrane potential, and how it affects muscle activity in hyperkalemic periodic paralysis? Question number 3. Why doctor advised to eat carbohydrate-rich food during the attack of hyperkalemic periodic paralysis? So now we are seeing answers of each question. So question number 1. How sodium and potassium ions affect cell membrane potential? So answer is sodium and potassium are the main ions that regulates the resting membrane potential and developing the action potential. Sodium ion concentration in the extracellular fluid is 145 millimole per liter and intracellular fluid it's 14 millimole per liter. However, the potassium ion concentration in the extracellular fluid is 4 millimole per liter and intracellular fluid it is 140 millimole per liter. The gradient of sodium ion from extracellular fluid to intracellular fluid it is 14:1, and the gradient of potassium ion from the extracellular fluid to the intracellular fluid it is 1:35. How sodium and potassium ion regulate the resting membrane potential? So here it's a cell membrane, and on the cell membrane there are sodium channels are present and potassium channels are present. When the equilibrium difference of the sodium ion put in Nernst equilibrium, it will give us the value of +61, and when we put the potassium ion, this value 4 and 140 milliequilibrium per liter in Nernst equation, then it will give the value of -94 millivolt. Alright, when we put both of these value in Goldman's equation, then it will be -86 millivolt. Now the sodium potassium pump adds -4 millivolt extra. So here the net resting membrane potential, when we add up both of these -86 millivolt and -4 millivolt, then it will reaches to the -90 millivolt. Resting membrane potential in nerve fiber it is -70 millivolt. However, in muscle it is -90 millivolt. Alright. What is the effect of sodium and potassium ion during the activity of the action potential? So here you are seeing the graph of the action potential, that is the depolarization, and here it is the repolarization. That is the two different activity that happen during the action potential. Alright, during the depolarization it activates voltage gated sodium channel, and these are the fast channels. So once the depolarization has been generated, the voltage gated sodium channels are activated and large amount of the sodium ion influx, that means entering inside the cell. So the more positive ions moving inside the cell, and it generates the action potential spike. Alright, during the repolarization phase the sodium channels are inactivating. So here you are seeing that the voltage gated sodium channels are inactivated, and on the later stage it will be closed. Now when we think about the voltage gated potassium channels, these are slow channels, and during the repolarization large number of voltage gated potassium channels become opens up and large amount of the potassium ion is coming out of the cell. But here one thing you should keep in mind, that the potassium channels are slow, however the sodium channels are fast. So here the inactivating gate of the sodium channel. So that is how the sodium and potassium ion regulating the wave of the action potential. Alright. Now the question number 2. What is the effect of eating banana which is high in potassium on cell membrane potential, and how it affects muscle activity in hyperkalemic periodic paralysis? So here it's the answer. Eating banana causes increase in potassium concentration in the extracellular fluid, and the condition is known as hyperkalemia. So hyperkalemia causes depolarization. Hyperkalemia, that means increase in the potassium ion, and potassium is a positive charge. So positive charge increase in the extracellular fluid, it causes depolarization. Hyperkalemic periodic paralysis is a dominant inherited trait that is caused by mutation in the alpha subunit of the skeletal muscle sodium channel. It is mainly seen in males. Out of 1 lakh persons, you will find this case in 1 person. So here it's the mutation of the alpha subunit sodium channels. Due to this alpha subunit mutation, the closure of the sodium channel is ineffective. So ineffective closure of the sodium channels, that leads to continuous inward flow of sodium ions, and due to this persistent depolarization of the muscle membrane, so that it lowers the action potential threshold, and due to this it produces the hyperexcitability, and this hyperexcitability causes the muscle spasm and fasciculation at rest. Eating banana, that means high in potassium. High in potassium, when it is present in the extracellular fluid, the condition is known as hyperkalemia. Due to this, there is increase in the depolarization, because the potassium is a positive charge and it causes the depolarization increase when the patients of hyperkalemic periodic paralysis eats banana, in which there is already mutant alpha subunit of the skeletal muscle, so that the inefficient sodium channel are present, and when they eat banana which is high in potassium positive charge, it increases the depolarization, so that there is inactivation of the sodium channels, and hence it blocks the action potential, and muscle paralysis will be the result. Question number 3. Why doctor advised to eat carbohydrate rich food during the attack of the hyperkalemic periodic paralysis? So here it's the answer. Eating high carbohydrate diet increases the insulin secretion. Insulin promotes transport of extracellular potassium to intracellular by activating sodium potassium pump. So here is the reason. Insulin that promotes transport of extracellular potassium to the intracellular by the activating sodium potassium pump. It decreases in the extracellular potassium concentration. It decreases the extracellular potassium concentration due to promoting the activity of sodium potassium pump, so that there is decrease in the depolarization, and due to that there is inactivation of the sodium channel is removed, and the paralysis is relieved. That's why the doctor advised carbohydrate rich food during the attack. If you like this presentation, please try to share it with your friends, group, colleagues and batch. Thank you so much everyone.